We think of February as a month of love with Valentine's Day, and we think about our hearts, but February is an important time for women to focus on preventing heart disease and promoting good heart health.
And we have Dr. Helayne Sherman with us today. She's a cardiologist at West Michigan Heart and Spectrum Health Medical Group with a special interest in teaching the public about heart disease and its unique effects on women. Of course, this week there is a big focus on women's heart health, but you have been doing something extra special that we don't know if a lot of people know about this program that you've been developing and working very hard on.
Sure. Well, thank you for having me here today. I would love to talk about the new cardio-oncology program. This is a new program at Spectrum Health, and it's a collaboration between myself as a cardiologist and the hematologist, oncologist, and the bone marrow transplant physicians within the community. And the goal of this program is to set up guidelines for monitoring patients' heart function before, during, and after chemotherapy. And if there are any if these patients are receiving cardiotoxic therapies, cardiotoxic meaning something that can damage the heart muscle, we want to follow these patients very closely, and there are now ways to both monitor and also intervene with cardioprotective medications so that patients can potentially continue with their therapies.
So are we talking about side effects or potential side effects from the chemotherapy drugs that these patients are given?
That is correct. There are a number of chemotherapy agents and other newer cancer therapies that can affect heart muscle function. And it can actually cause a decrease in the heart function. And in the cardiology world, we have great medications that we have been using for 20 and 30 years to treat what we call cardiomyopathies or weakened heart muscle. And what I'm doing now is using those same medications, but in the realm of cardio-oncology now.
Yeah, unfortunately in this day and age, I think a lot of us know somebody that has had cancer and had to undergo chemotherapy, and you hear about the devastating effects in how tired and how the body changes, and from the drugs and the treatment to get better.
Right.
You don't always think about the impact that all that is having on your heart, which is a major factor in your health and wellness too.
Well, you bring up a really good point. If you look at the data now, patients who have cancers, their #1 cause of death is a recurrence of their underlying cancer or malignancy. But the #2 cause of death is now cardiac etiologies.
So heart failure?
It can be heart failure, yes, if you have progressive damage to the heart muscle and the heart muscle function declines. Ultimately, yes, it can lead to heart failure. And so the goal here is really to intervene very early, monitor heart function if there's any change in heart function, to intervene with these cardioprotective medications. And our major screening is echocardiograms. Echoes, which are ultrasound of the heart, so they're very safe. We have some very new imaging techniques where we are actually able to start predicting who might be at risk for having a heart problem and treat them even sooner. And again, the goal here is to treat the heart muscle problem while the patient is receiving chemotherapy, so they don't have to stop their potentially life-saving medications.
You have an opportunity for people to learn a little bit more. Of course, if I were watching this at home and I had a loved one of myself, I'd be extremely concerned because there is a lot to know about this, and an opportunity for people on the 13th to learn a little bit more.
That's correct. We have a very exciting program. This is sponsored by Spectrum Health. It's a community event, free to the public. We just ask that you do register. And I will be speaking on our cardio-oncology program. We have another physician, Dr. Diana Bittner, will be speaking on menopause. And we also have a third speaker addressing diabetes. So it should be a very exciting program. Dinner is included, so please join us.
Really exciting to think about this groundbreaking research and groundbreaking program and treatment options for patients here in West Michigan. If someone's interested in getting in touch with you or maybe someone in your office, can they just call or reach out to you? Your contact information is here on the screen.
Absolutely. This program is open to anyone within, Western Michigan and beyond. Many of the referrals now come through the offices of the oncologist, the hematologist, but patients are able to self-refer. And I'm happy to see them.
Well, wow, the 13th sounds like a great way to take care of your heart physically with some experts, great women in your fields, and then go out and celebrate Valentine's Day the next day, right?
Right.
Thanks for coming.
Yeah. Thank you so much.
Yeah, we'll be right back.
That's West.